Welcome to Sentencing Stats. This presentation briefly reviews some new data and new charts that we have developed in light of the COVID-19 pandemic that can be used to assist you with respect to your sentencing memoranda, appellate briefs, and in particular, compassionate release and 2241 petitions. We do track the BOP data on a daily basis down to an institutional level, as well as other data sources that are relevant. This just is an example of a custom chart that we've developed. We compare the total number of deaths as a result of COVID-19 in the Bureau of Prisons to other causes of death there. This really illustrates just how deadly COVID-19 has been within the Bureau of Prisons. There have been a total of 148 inmate deaths plus two staff deaths so far. But within a 16-year period, 2001 through 2016, there were a total of 161 deaths from AIDS. So it shows you just how much more deadly COVID-19 has been. This is 148 deaths just since March, and we're projecting 231 deaths when this number is annualized. So by March of 2021, we're expecting 231 deaths, which will exceed the total number of deaths from AIDS, from accidents, and from homicide over a 16-year period, and will be close to the total number of deaths from suicide over a 16-year period. In any given year, the BOP averages only 374 deaths from all sources. So clearly, as you can see here, COVID-19 is now the number one cause of death within the Bureau of Prison. It's actually the number three cause of death within the United States overall. As mentioned, we do track the BOP data on a daily basis. Our charts are meant to help counter some common objections by the government when filing, for example, for a compassionate release petition. There have been a total of 23,569 staff and inmate infections to date. This compares that number to the number of inmates that have been transferred under the BOP's CARES Act authority to home confinement. The BOP constantly states that it cites this as an example of what it's doing to try to combat the virus and the spread, but as you can see here, it's really not doing much. After early July, it's been rather flat. Only 1,200 inmates, more or less, have been transferred to home confinement since that time, but during the same period of time, you can see the number of infections has continued to skyrocket. This chart makes a bit of the same point from a different perspective. Instead of cumulative infections, we here just track the number of active infections of inmates and staff from the same period during the same period of time, and we compare it to the overall inmate population. So you can see here that when the outbreak first began, the BOP did do a pretty good job of quickly lowering the population of its inmates. But that stopped around mid-August, or really, I should say, slowed, and now it's just they're just trickling out. It's been rather steady since early September, but during that same period of time, as you can see here, there have been two massive peaks coinciding with outbreaks at various facilities, and now we're in the midst of a third peak, which may in fact be larger than the prior two. Point being is that whatever the BOP is doing is not very effective to halt the spread of the virus. And in fact, here we compare the positivity rate. In other words, the ratio of positive tests to tests administered, and it's been holding rather steady above 25%. Anything above 5% is considered an uncontrolled outbreak by some sources. So this is rather significant. If the BOP was being if the BOP's procedures were effective, you would expect this ratio to decline significantly, but it's been rather steady. It did decline from way up around 35% in June, but since around August, it has stayed rather steady and quite high at that matter. As mentioned, we do track data down to the institutional level, so we could provide you with institution-specific charts such as this. What this particular chart shows for FCI Bastrop is that here's the its weekly population as reported by the BOP, but it's stayed above its rated capacity. And this is rather problematic this far into a pandemic, that an institution remains so consistently above its rated capacity. And this is the total number of tests that have been performed. Not necessarily that there have been 795 inmates tested, but that only 795 tests have been performed at an institution that has consistently remained above its rated capacity. So what the point of this is, it shows that this institution is susceptible to an outbreak. Obviously, the more people you have crowded into a particular institution, the higher likelihood of transmission. And in fact, over the last couple of weeks, FCI Bastrop did experience a significant spike. What is a little bit odd about this spike is on November 9th, the BOP was reporting 268 infections, but then magically dropped down to 151. BOP has not provided any explanation for that. And as far as we're aware, nobody recovers that quickly from an infection from COVID-19, let alone over 100 inmates within a 24, 48-hour period of time. And finally, we also track all the data for surrounding counties, the counties surrounding a particular institution, to show whether there are active infections within the surrounding community as well. Obviously, if you have visitation, and some BOP institutions have reopened visitation, and of course you have the guards and staff for the particular institution coming and going on a constant basis. Here, while the surrounding county doesn't have a lot, relatively speaking, doesn't have a lot of infections, they do have infections, and it's been maintained it's been at a steady rate since early August. So hopefully this gives you a brief overview, or just a good idea of some of the data and analysis that we can provide. Of course, we can customize it to your needs. Happy to work with you. Thank you for your time.